Hello CBC, I'm Doug Hughes, CBC's Dean for Health Sciences, and I'm here to explain why COVID-19 is a global pandemic and discuss what we can do to avoid catching or spreading the virus. There are many types of human coronaviruses, including some that commonly cause mild upper respiratory tract illness. COVID-19 is a new disease caused by a novel or new coronavirus that has not previously been seen in humans. Scientists and health professionals are still building their understanding of how the virus works and are attempting to make predictions about infection rates using statistical models. There is currently no vaccine to prevent the coronavirus disease, so the best way to prevent illness is to avoid being exposed. The virus is thought to spread mainly from person to person when in close contact with one or another person through respiratory droplets. Some recent studies have suggested that COVID-19 may spread by people who are not even showing symptoms, which is known as asymptomatic. Therefore, Washington's Department of Health created an order to wear a mask while in public. It's important to monitor your health and be alert by knowing the symptoms, especially if you're an older adult over the age of 65 or a person of any age with severe underlying medical conditions like heart or lung disease or diabetes. The virus does not discriminate. Anyone can have mild to severe symptoms. Watch for things like fever, cough, shortness of breath. However, other symptoms that may be confused with seasonal allergies or flu-like symptoms such as fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat, congestion or runny nose, even vomiting and diarrhea have also been identified as possible symptoms. The CDC will continue to update the list as we learn more about COVID-19. There is even a self-checker guide on their website to help you make decisions and seek appropriate medical care. Please seek emergency care immediately if you experience emergency warning signs such as trouble breathing, persistent pain or pressure in the chest, confusion, inability to wake or stay awake, and bluish lips or face. Symptoms may appear 2 to 14 days after exposure to the virus. Please quarantine if you may be sick or are exhibiting symptoms. You may ask when to start and end quarantine. You should stay home for 14 days after your last contact with a person who has COVID-19. Even if you test negative for COVID-19 or feel healthy, you should stay home as symptoms may appear 2 to 14 days after exposure to the virus. The CDC has a list of different scenarios to help you determine when you can end quarantine and be around others. If you've been exposed, you may be contacted by a contact tracer from the health department who will walk you through the process. Isolation is used to separate people infected with the virus, even those with no symptoms, from people who are not infected. If you have had symptoms, you can be with others after 3 days with no fever and respiratory symptoms have improved, and 10 days since symptoms first appeared. If you tested positive for COVID-19 but have had no symptoms, and you continue to have no symptoms, you can be with others after 10 days have passed since testing. The CDC has been consistent with the following guidelines to prevent the spread and flatten the curve. Frequently wash your hands for at least 20 seconds. Avoid touching eyes and nose with unwashed hands. Avoid close contact with people who are sick, and put distance between yourself and other people outside of your home. Stay at least 6 feet, about 2 arms length, from other people. Remember that some people without symptoms may be able to spread the virus. Be sure to cover your nose and mouth with a cloth face cover when around others, and clean and disinfect frequently, touch surfaces daily. Please keep in mind that CBC will continue to operate remotely, but will offer some face-to-face instruction if they are deemed necessary. These approved face-to-face classes are not directed by the phase the county currently is in, as long as we continue to follow the strict safety protocols put in place for the safety of our students, faculty, and staff. Cloth face coverings may help prevent people who have COVID-19 from spreading the virus to others. Wearing a face covering will help protect people around you, including those at higher risk of severe illness from COVID-19 and essential workers who frequently come into close contact with other people. Cloth face coverings are most likely to reduce the spread of COVID-19 when they are widely used by people in public settings. The spread of COVID-19 can be reduced when cloth face coverings are used along with other preventive measures, including social distancing, frequent hand washing, and cleaning and disinfecting frequently touched surfaces. They are not to be used in replacement of social distancing. The cloth face coverings recommended are not surgical masks or respirators. Currently, those are critical supplies that should be reserved for healthcare workers and other first responders. For the general public, wearing gloves is not necessary in most situations like running errands. The CDC recommendation does suggest wearing gloves when cleaning and disinfecting or providing care to someone who is sick or other surfaces that may be frequently touched in the home. To properly don the gloves, there really isn't a right or wrong technique per se. You just want to make sure that they're going on completely and covering the hand completely. Make sure you get your fingers all in the right spot. And it's really important while you're wearing gloves that you try not to cross-contaminate. So if you're touching a surface and then touching your face, it really is not meeting the purpose of wearing the gloves. To remove the gloves, simply grasp the cuff of one glove with the gloved hand on the other hand. Move your fingers underneath that cuff without touching your skin and pull that glove inside out. Then you want to do the opposite to remove the second glove. You want to take your ungloved hand, slide a finger inside the glove so that you're only touching skin to skin without making contact with the outer surface of the contaminated glove. Pull that glove inside out, containing the two inside each other, and then dispose of them in a proper receptacle, followed by a hand wash. The best way to protect yourself from germs when running errands and after going out is to regularly wash your hands with soap and hot water for 20 seconds or use hand sanitizer with at least 60% alcohol.